Sometimes they feel the same primeval or very early stages, just like a baby. When a baby comes out, baby doesn't feel in control. Like my little son, he's whacking himself. He can't do anything. And when if something happens when a person is in a child or even a womb or or they're picking up, they can hold stress there. And it's like just raw emotion, okay? And it can't be analyzed that well with your mind. And it just gets sidetracked. That's why if you ever massage psychiatrists, you'll find psychiatrists that are some of the tightest people around. Not only that, if you ever look at the rates of suicide of any profession, guess who's the highest? Dentists and psychiatrists. Like everybody hates your dentist, And the dentist can't laugh at the people either. That's why.
I've got, surgeons. I've massaged 5 surgeons. They're all leading, cutting-edge guys in Adelaide.
Yeah.
And they hold the most tension.
Right.
And I know you said not to analyse, but I can't help but doing it because it's an hour of living at the time.
Yeah.
Are they taking on everything from what they're doing with operating on the people?
Well, with them, it's a very stressful thing too, because they're under a lot of pressure, and anything that they do could be a big mistake. They could make a big mistake, and they're under a lot of pressure. I guess it's like working with people under crisis situations. Like say you were to go and work in Iraq on the troops or something like that, or in those where there's a lot of post-traumatic stress disorder. It's different with surgeons. They're more like, I've got to do this properly, because a lot, like a pilot piloting a plane through with 300 passengers when the engines aren't working, or the guy who had to land his plane recently on the river in America. That guy's like, there's a hell of a lot of responsibility on my shoulders. And that's also a bit different than what you will find that with people with a lot of responsibility. Responsibility makes it that I cannot afford to, I have to be in control. You want that guy who's piloting your plane to be in control. And it's the same, I find, like working with, say, people who are matrons, what I call the matrons of nurses. They're under a crisis situation, everything has to be ordered, and it's a slightly different thing than what I'm talking about there. With the psychiatrists, they're just listening to everybody's stuff. They're not trying, and they're trying to kind of, they're absorbing it. There is also that element of working with, say, emergency people, which I would call a surgeon. Sort of somebody who's dealing with a very stressful situation, or a pilot of a plane. Pilots obviously most of the time nowadays they're on autopilot and stuff, but if they have a situation where they've got 300 lives in their hands, and it's a very, that person's going to tighten, their body's going to be tight, because that's what you do when and then all the different chemicals and stuff, But yeah, psychiatry. So with our style, it's different, very different than psychiatry, and I've found it more effective. A lot of people have come to me and they said they've been to, a psychiatrist for so many different problems, and this massage has fixed their problems in one session, even, or 2 sessions, 3 sessions, and they go, I don't need to, So I think it must be frustrating being a psychiatrist and not being able to help people all the time, and just getting caught up in everybody's problems, as well. But yeah, there is an element of that, what I said there with them as well, being in control and being serious. I like to laugh a lot when I massage people, even when they're in agony, and you'll see that as a massage. That helps me not to absorb their stress, And I laugh with them and at them. I say, hey, good, you're getting rid of your tension. I use a bit of laughter therapy, Bronson hasn't quite mastered that yet, so you'll realize that. He said, I don't laugh like you do, Brandon. Yeah, we'll get you there. So you may see I laugh a bit more than Bronson does. People are in agony. I'm quite happy with my own craziness, I've come to terms with it. My wife called me a loving psychopath, but she doesn't. You're different. Yeah. Some of you guys aren't going to that, of course. All right, any other questions?
I found that so far that older Chinese women, that's really hard to train.
Mm-hmm.
Because of their upbringing, I understand how it was. Like my mom would be the same. I haven't actually done it to her yet, but I'm sure it will be the same problem. We probably know, 50 plus older Chinese women, they were expected, the way they were brought up, they were expected to be helpful to everyone, including people that's massaging them. And also, they keep everything inside. They're not really supposed to show emotions a lot, you know.
Yeah.
And they just keep things inside, and they're really hard to treat. Like one of the things she made, like she wouldn't really breathe with you, and if you were trying to rotate her ankle, they tried to help you with it, but they're really, really hard there. And and not just that one, but my sister-in-law, she's also old, and and she's like that as well.
She's like 40 or something.
That was
It just make it nice.
yeah, well, actually, I'm not that much younger than her, but you know,
Yeah.
but they're very they just hold things so much.
Yeah, so there's a lot of cultural things. In fact, when you live in a multicultural country or a society, it's very important to understand your culture. You know, like say, for example, we're looking at what you're talking about there with elderly Chinese people.
Yeah.
Having certain programming, you must behave like this, you must do this, you should not show this emotion, you should not. In Australia, it's different for the men. You work on most men, it's really difficult. They're really scared of crying in front of people because they can show anger. But with women, it's like they can cry easily, but some women have difficulty showing anger, you know. So every culture is different. Whereas if you work on an Italian man compared to an Australian man, he might cry a lot easier because Italian men are more emotional. Is that right, Martin? Yeah. And so when you're working in, and I see that all over the world. Everybody's quite different, and some people, like when I first started teaching in England, everybody's really uptight usually, and then once you get into them, they're like, they just love it because, but their culture teaches them, oh, you must, the stiff upper lip or something, which sounds similar to what the Chinese do. Keep it all inside, and then they get very stiff in their bodies. When you get stiff in your mind, you're going to get stiff in your body.
Is that when you get to the head first?
Yes. Head first and belly. And you don't work them so hard, because if you get something like that and you work them really hard, they just end up...
Not only that, their skin's so fine, like I'm not normal, but I'm like that. But skin is so fair, and it's just so easily bruised.
Yeah. See, so what we got there is it's a control thing, a culturally induced control trip with their mind. Okay? So you would come to their head first. And also what you're wanting to do there is get them to breathe into their belly. So you would start on their head, then come to their belly, work their belly, get them to breathe. But again, you're not going to, and what you're wanting is the opposite of what they are. See, they are hard and rigid and controlled. What you want then to emphasize in your massage is rhythm. So making the massage like a river, flowing. And then they start to kind of go. But you do their head first. It's like putting somebody into a drugged out space, because the person could be like this. Oh yeah, I'll move that, and I've seen people, their movements are very, and they're, and then you massage their head, and then they, what, and then that's the way you want to massage them. You want the person to be kind of like that, huh? Oh yeah, because you're going to be controlling. So that's what good head massage can do. And then you get them to breathe into the belly as well. And then, so in that case, you need to relax them. You may need to spend 45 minutes relaxing them before they even get started on the massage.
But I think the hardest thing is actually people come in, my back's sore, my neck's sore, it's like, actually that tension's coming from the front, but start getting, no, too hard or too painful. And so I guess get doing that head, but how do you get around and say like, no, I don't want my head done, I want my back, I'm here for my back. It's like sports people or fitness, I get people.
Yeah, they're called annoying patients. They're called patients that want to control the treatment. Okay.
Yeah.
Also known as annoying patients, right? So what I do, okay, yeah, you know better than I do, right? Okay, so we massage your back, okay, did that work? Oh, no, yes, because, well, you know why your back's not released? It's because of what I told you at the start, And when are you going to actually let me do what, who's the expert? You, So what I would do, that's really what it comes down to, right? Is you've got to prove that you know their body better than they do. So before you actually get in and do some complicated diagnosis or what they think is complicated because they're making their back tight, which is actually very simple, right? From our perspective, it's kind of obvious, right? But before you get into that, right, one of the early stages of a treatment is to develop trust with that person, but also for them to, they gotta understand that you know their body better than they do, in a sense, or a lot of those people, because they obviously don't know their body. They come in, oh, my back's tight. But yeah, okay, and you're going, okay, well, it's probably coming from, yeah, your chest is pulling forward, making your back muscles tight, or your feet are tight, making the back of your legs tight, that's putting pressure on your back. You know, that's obvious to us, but they don't know that, right? So before you get to that stage of treating them that effect, what you're actually doing is showing them that you know their body better. And so what you're doing is, okay, you know, then so you're activating a lot of pressure points, you're doing a lot of things to loosen up and working different areas. And they're going, ow, oh, I never knew I was so sore in my